Okay, knock knock. Hi, my name is Karla. I'm going to be your nurse for today. I'm performing hand hygiene, putting on my gloves. Can I verify your name and date of birth, please?
Yes, Natalie Gonzalez, and I was born January 30th, 1999.
Okay, everything matches. Okay, I'm going to be performing your head to toe assessment today. I'm going to start by asking you some questions for your urological exam. So, do you know where you are right now?
Yes, I'm in the hospital.
Okay, do you know what day today is?
Today is Sunday, November 22nd,
Awesome. And do you know what year we're?
2020.
Yes. Okay, so I'm going to start first by inspecting your head. Is that okay?
Yes.
Okay, so I'm going to be inspecting her head, looking for any infestation. I'm going to palpitate for any lesions, bumps, any signs of baldness. No, everything looks normal. Okay, so now I am going to start with your cranial nerves. I'm going to start with cranial nerve number 2, the optic nerve. So if you can tell me how many fingers I'm holding up.
4.
Okay, good. And now I'm going to check your cranial nerves 3, 4, and 6, the ocular motor, the trochlear, and the abducens nerve. Wait, can I get my pen light? Okay. Okay. Awesome. Okay, now you can follow the lights without moving your head for me. Perfect. Okay, pupils are equal, round, and reactive to light. And movement is good. And now I'm going to go down to your nose. I'm going to be checking cranial nerve number 1, your olfactory nerve. I'm going to be giving you a call in to smell, and you can identify the smell for me.
Okay.
Can you tell me what you're smelling?
Alcohol.
Okay, cranial nerve number 1 is intact, and I'm going to inspect your nose. Okay, patency is good. No patency is pink, hydrated, no drainage. Okay, I'm gonna pop you for any lumps. Everything looks good. Okay, now I'm gonna move down to cranial nerve number 7, the facial expression nerve. If you can smile for me big, please. Awesome, okay? Face is symmetrical, and now I am going to inspect cranial nerves 9, 10, and 12, the glossopharyngeal, vagus, and hypoglossal nerve. If you can swallow for me, please. Okay, cranial nerve number 9 is intact. And your taste buds, are they good? Do you taste pretty well your foods and your meals?
Yes.
Okay, awesome. Cranial nerve number 10 is intact. And how about cranial nerve number 12? If you could please take out your tongue for me and move it around. Awesome. Cranial nerve number 12 is intact. Now I'm going to inspect your mouth. Make sure your gums are hydrated, no strong odor. Okay. Now I am going to move on to cranial nerve number 5. I'm going to ask you to close your eyes, please, and then tell me if you can feel this.
Yes.
Okay, awesome. And now I'm going to check your temporal pulse bilaterally. Okay, pulse is strong and regular. And now moving on to cranial nerve number 8, the vestibular cochlear nerve. If you can tell me what ear you hear this in, please.
Left.
Okay.
Right.
Awesome. Okay, now moving on, going to inspect your ears, make sure there's no drainage, no discoloration. Okay, looks translucent, looks good to me. Let me see this ear. Okay, everything's translucent, no discoloration, no drainage. Now I'm going to move on to cranial nerve number 11. So I'm going to ask you to shrug up your shoulders against my hands, okay? So try to resist. Okay, cranial nerve number 11, accessory nerve is intact. We're good with the cranial nerves. All your 12 cranial nerves are good. So now going to move down to the neck. So in your neck, I'm going to ask you if you could move your head to side. Okay, so range of motion is good. If you can look up for me. There's no tracheal deviation. It's aligned. No signs of JVD. Now I'm going to check your lymph nodes. So your submental and submandibular are good. They're firm. No signs of enlargement. Pre-auricular, post-auricular, upper cervical, middle cervical, lower cervical, posterior triangle, and supraclavicle. Okay, your lymph nodes are good, they're not enlarged. And now I'm going to be taking carotid pose, checking to see. Bilaterally, your carotid pose is strong and regular. Awesome. Okay, now I'm going to move down to your chest. Going to be taking your lung sounds. So I'm going to do 6 in the front and 8 in the back. Okay? Okay, lung sounds are clear, no signs of wheezing. Gonna check the ones on your back now. Okay, lung sounds are clear in the back as well. Now I'm going to be checking your heart sounds to see what your heart sound is. Going to start with the aortic. If I could just, thank you. Now we'll move on to pulmonic. Tricuspid. And mitral. Okay, so heart sounds are clear. There's no signs of murmurs, and S1, S2 sounds are good. Okay, so now I am going to move down to your abdomen. If it's okay if I can expose your abdomen.
Yes.
Okay, I'm going to inspect the abdomen. Make sure it's not distended, it's flat. Okay, abdomen looks good. Now I'm going to auscultate and listen in for any bowel movements. I'm going to start with the right lower quadrant, go up to the right upper, left upper, and lower, left lower quadrant. Okay.
Where? Why ask you? No.
Okay, so bowel sounds are active. They're not hyperactive, so there's no sign for diarrhea or hypo. You don't have no bowel obstruction or upper lytic ileus. So I'm going to palpitate and make sure there's no tenderness or pain, if that's okay with you. Okay. I'm going to palpitate lightly. Okay, there's no sign of pain, there's no tenderness in the abdomen. Okay, abdomen looks good. Now I'm going to check your upper extremities. If you could, yes, you can put your arms out for me. Okay, skin looks hydrated. Feels cool, it's not clammy, it's not dry nor hot. There's no signs of rashes, lesions, or abrasions. Awesome. Okay, if you can move your arms around like this, put them up, down. Okay, range of motion is good. I'm going to check your capillary refills. Capillary refills are good. Okay, now I'm going to take your radial pulse, please. Good. Bilaterally. Radial pulse is strong and regular. If I can take your brachial pulse. Take it bilaterally. Awesome. Okay, so your radial and brachial pulse are strong and regular. I'm going to ask you if I can take your femoral pulse. I took the patient's femoral pulse. It's in the groin. And it is strong and regular. And then now if you can sit back so I can check your lower extremities, please. Okay, so please. Okay. Let's expose, yes, your legs. I'm going to be taking your popliteal pulse bilaterally. And I'm going to inspect and look at the legs for any signs of DVT. Skin looks good and hydrated, it's cool. She's not clammy, she's not hot. Okay, there's no signs of any ulcers. There's no signs of any ulcers, any rashes, abrasions, or lesions. Okay, I'm going to check her capillary refills in her toes. They're good. Capillary refills are good. Her tibial pulse bilaterally, and her pedal pulse bilaterally, and her pulse is strong and regular. I can have you flex and extend your foot. Awesome, if you can move it in circular rotation. Good, so her range of motion is good. And now I'm going to ask you if you can please stand up to assess your gait, make sure you can emulate well. Do you use any devices to move around?
No.
Okay, if you could put your left up, good, your other leg, good, so patient can ambulate well. Can you walk 5 feet forward? Good, patient ambulates good. Awesome, and you can please sit down again. Are you doing fine, Natalie?
Yes, I am.
Awesome. Okay, so I'm going to document my findings. I'm going to make sure I write everything down. I'm going to leave your call line here. If you need anything, feel free. Don't hesitate to call me. I'm going to put the rails up 3 times. And I am going to perform hand hygiene again. Natalie, are you safe at home? Do you feel okay?
Yes.
Awesome. Okay, well, I'll be back, okay? If you need anything, you know the light is there for you to call me.
Okay, thank you.
Awesome.